Make sure the patient is in a supine position. Flex the child's knee. Secure the leg into position with tape and towels or a small blanket. Identify landmarks on the child's leg. Palpate 1 to 2 finger breadths below the tibial tuberosity on the medial aspect. This flat side of the bone is the preferred site. Select the correct size of bone marrow needle. The size of the patient's leg should be used to determine the proper depth for insertion. If the needle you are using has a stylet present, ensure that it is properly aligned. Prepare the needle and cleanse the area with an antiseptic wipe. Insert the needle pointing away from the epiphyseal plate, also known as the growth plate, and pointing toward the foot. Use a gentle but firm twisting motion to advance the needle until it penetrates the bone marrow. Too much pressure may cause the needle to push through the bone into the soft tissue behind it. At this point, the needle should stand unsupported in the bone. Unscrew the cap and remove the stylet from the needle. Attach the pre-filled 10 cc syringe and aspirate to see if bone marrow comes back in the syringe. If no marrow is aspirated, inject 2 to 3 cc of saline. If the fluid does not flow through the syringe, or if any fluid goes into the surrounding tissue, discontinue infusion attempts. Remove the needle and place a small dressing on the site. Attempt the procedure in the other leg if no injuries or burns are suspected. Secure the IV infusion set onto the hub of the needle and attach the IV bag with administration set. Directly infuse the fluid through the IO site or give 20 cc boluses using the 30 cc syringe. Secure the needle and IO site with a dressing. Reassess the site frequently for swelling or oozing of fluid, which would indicate possible infiltration. Also, assess the dependent part of the leg for any signs of extravasation of fluid from the bone marrow. If either of these conditions occurs, stop infusions immediately.